I'm Dr. John Kruse, and today I'm going to be talking about shrinking the shame of ADHD. Where I'll start is talking about what are sources of shame or where does shame come up. So I'll go through a few scenarios. Let's pretend you're at a work meeting and you're working from home and everyone else is on Zoom and you're paying attention to your 3-year-old or to an interesting cat video you have somewhere else on the screen, and you're called on and you start to answer and you get cut off by your manager who says, Joe just already told us that. Your reaction is probably, feeling that you should have paid attention, you feel shame. Often that can spiral into a bigger negative mass of emotions, including I'm worthless, I shouldn't be at this company, I don't deserve to have this job, everyone's going to think I'm an idiot. So shame can quickly spiral into an expanded sense of negativity and depression and even suicidal thoughts. Other situations with ADHD that can cause rise to shame is impulsivity. So you're meeting your friend Cheryl, who you haven't seen in several weeks, who you've been sheltering in place, and when you see her, you say, oh my God, that's an ugly shade of purple on you. So your impulsivity, many other people might have thought the same thing, but with ADHD, you're more likely to blurt out a comment before you think about it fully. That can lead to, again, a social situation where you feel that you've done something inappropriate. And certainly hyperactivity. So if you're at a meeting or in a group and you're the one drumming your feet or tapping your pencil or doing annoying things or bumping into people that are causing social transgressions that are more likely for you to be doing because you have ADHD than someone else might be having such issues. And the fourth sort of big area where ADHD can lead to social transgressions is just through emotional underregulation. So many people with ADHD have emotions that come up more strongly, more vividly, more immediately. And other people may feel, understand why they're upset, but why are they screaming at everyone like that? Or why are they breaking into tears just because I commented on something they said at the meeting? So all of those are causes for social transgressions or people to be breaking social rules. A frequently tossed out in ADHD circles statistic, and it's not an actual study that was measuring things, but Michael Jelenic, who's a Harvard-related psychiatrist, estimated, back envelope calculations, by the age of 12, the average kid with ADHD purely at school is receiving 20,000 more negative comments for ADHD-driven behaviors than a non-ADHD kid. Dr. Dodson in Colorado is the one who's popularized that statistic. And again, it's not an actual measurement. It's a back of the envelope calculation based on how many times the kid's likely to do something that the teachers are likely to think is inappropriate or not fitting. And it's not surprising with all that negative feedback being told over and over again that you're wrong, that you're defective, that you did something inappropriate. The kids with ADHD may grow up with a negative self-image or a feeling that they are wrong or defective. That's separate from all the negative messages they may well be receiving at home or from peers in playground or other activities. I'm going to probably be sloppy and go back and forth with mixing shame and guilt together. They're very closely related emotions. The emotion of authorities, experts would say that guilt occurs when you perceive that you've broken a social rule, someone else's, that you shouldn't be interrupting other people's conversation in a classroom situation. You might feel guilty for doing that. Whereas shame is often precisely described as when you're failing to live up to your own moral or life standards. Part of it is that shame then goes pervasively deeper. It's not that you just did something bad, but shame, or the essence of it for many researchers, is that you are actually bad because you've done these bad things. Interestingly, measurable detection of shame can occur in little kids as early as 15 months old, but usually to detect guilt, we need to find kids as old as 3, 4, 5 when that starts kicking in. So again, guilt is breaking a clear social rule. Shame is when you're feeling that you've done something wrong, you didn't live up to your own standard of expectations. And although all of our basic emotions, including shame and guilt, have a clear physiological, biological origin, clearly there's an interaction with society. So different societies have different rules about what's appropriate, what's inappropriate. So I'm not pretending that everyone in every society is going to feel shame or guilt for the same set of situations, even though the triggering factor of feeling that you have not lived up to your standard is universally connected with shame. So I divide shame into a shame that I can't count to three different categories. One is problematic ADHD behaviors can lead to shame. So I call that action-based shame. And those were some of the examples I began the session with. Number two is stigma about ADHD. So knowing that if you're given that label, people may think certain things about you, and particularly certain negative things about you. So I would call that shame about the essence of ADHD. And then a third source of shame related to ADHD is if you have it knowing or seeing someone else with ADHD behaving in a way that you think is shameful or disrespectful or inappropriate, or that other people will. So I'm given that, like my book again. My book is Recognizing Adult ADHD, What Donald Trump Can Teach Us About It. Clearly, he meets full criteria for ADHD, but many people are horrified and stigmatized and saying, oh my God, I don't want to be tied with him. And I'll get into how we get rid of that. But that would be an example of association-based shame. It's not that you're ashamed of having ADHD, it's that you're ashamed of having something in common with someone you think is behaving in a shameful way. So the approaches that I'm going to talk about for getting rid of or either eliminating or at least shrinking or reducing ADHD are based on some dialectical behavioral therapy or DBT approaches. I have modified them somewhat, so don't blame DBT if I say something that seems stupid or wrong or off. So the working principle with DBT has for working with emotions reminds us that emotions aren't just a feeling state inside. So sadness isn't just feeling sad. Shame isn't just feeling shameful. Anger isn't just feeling shameful. So in addition to that internal emotional feeling state, an essential part of emotions is also facial expression. So anger looks the same everywhere. Shame looks the same across cultures. Sadness has a diagnostic, set of facial features. And also there's what we call action tendencies. So it isn't that an emotion forces you to act in a certain way, but it increases greatly the likelihood you do. And it does that through differential blood flow to different muscle groups and to different physiological, so effects on heart rate, effects on body temperature, effects on constriction of blood vessels. So with shame, the action tendency that's encouraged is that shame makes you talk more quietly. And sometimes you can't even get the words out. And to lower your head. And for some people are susceptible to that, to blushing. DBT's approach is to work to reverse those action tendencies, because if you're working against what the emotion is innately making you do, you're in part erasing it. And then also to get back to the trigger for shame and trying to find or work around that. So with shame, the feeling is I failed to live up to some of my expectations or standards. There's one big bifurcation in terms of dealing with shame. So there are some situations where you may feel that you have done something wrong and that you're going to try not to do it again. There's some situations where you might have felt shame and you might on further assessment decide, well, no, it's not even appropriate to feel shame there. And so there's a slightly different treatment approach for those. So in the first situation, let's say I wasn't paying attention in the meeting and I didn't know what the previous speaker said, so I said something wrong. So when I think about it, I'd say, yes, that's inappropriate. There's a legitimate reason for shame that I did something not paying attention in a meeting that I should have done. So the way to correct it is in a loud voice and out loud, standing tall, so not with your head down, not in a whisper, saying, I did this. I was inattentive in the meeting. And to make sure that it doesn't happen again, I will remove distractions. I will turn off other programs on my computer. I will take my medication on time to make sure I can be as attentive as possible in future meetings. So that would be dealing with shame in a situation where, again, you felt that the shame came up inappropriately. On the other hand, in the same meeting where you didn't do anything particularly wrong, but someone says, you have ADHD, don't you? And you get ashamed and feel bad about that. And you think about it, you acknowledge, yes, I have ADHD. That's not shameful. So in that situation, the way of countering it is to say them out loud in a loud, clear, definitive voice, looking straight ahead and not down, is, yes, I have ADHD. And actually, I don't think there's anything shameful about that. So I will try to manage it. I will try to work with it, but I'm not going to try to eradicate or deny that, yes, that is part of who I am. The DBT approach is to work against the action tendency. If you feel you did something shameful, it's to say, yes, I've done this, and this is how I'm going to make sure this doesn't happen again. And if it's something you did that you don't feel you need to be shameful about, it's saying, yes, I did this, and I'm going to continue to be this way because I don't need to be shameful. So again, those are two different ways for dealing with action-based, what I call action-based shame, where you've done something that's a social transgression or infraction. Two other things to remember are that medications, if you're on them, and some of our cognitive behavioral therapy and other therapies are actually helpful for changing some of those behaviors that contributed to the social transgression. So if you're on your medication and it's a proper dose and it's working for you, you are less likely to be inattentive, you're less likely to be impulsive, you're less likely to be hyperactive and bumping into people or tripping over yourself or say restless noises that are annoying others, or to be emotionally underregulated and bursting out on others. And similarly, many of the cognitive behavioral strategies for dealing with ADHD can reduce the likelihood that you display some of these specific behaviors leading to the action-based shame. Moving on to what I can call essence-based shame, where you are ashamed about the very existence of you having ADHD. How do you overcome that? At the core of it, it's dealing with being a human being. All of us are human beings. What I usually tell my patients is that except for the 6 or 7 perfect people on this planet, all of us make mistakes. And I say it that way because, when you think, no, there aren't 6 or 7 perfect people anywhere on this planet. We use the phrase so often, nobody's perfect, that it sort of is so trite and cliched that people don't even hear it and register it. There is a deep and fundamental and important truth in that. But people often don't hear it if you just say nobody's perfect. From all that we know, ADHD is a biologically based condition. That doesn't mean it's the only factor contributing to it, but it is one that you didn't have any choice about. That there are genetic components, that there are in utero exposure elements, that this is a biological part of who you are. Again, medications may help you manage it, therapy may help you manage it, but it is an intrinsic aspect, and it's only one aspect of who you are. So you are probably also have a gender, or have a race, or have a nationality, or have a certain height, or have a certain weight, or have a certain aptitude for liking chocolate ice cream or not. All of those are aspects of you. None of them constitute all of who you are. ADHD, even if it may be pervasive, even if it may affect many different interactions, is still only one aspect of who you are as a person. And particularly with ADHD, one of the things to remember is none of the problems that ADHD causes are unique to ADHD. And by what I'm trying to get at there is blurting things out are things that everyone does at least occasionally. Being inattentive and missing a social cue or missing a piece of information, a presentation, is something that everyone does at least occasionally. And the issue with ADHD is that, yes, you're doing it more frequently, but if you're feeling bad and horrible in a meeting because you were inattentive, why would that make you a horrible, awful, defective, wrong person when everyone does it at least occasionally? Again, it doesn't make sense at its essence, and it's getting back to you're feeling that way probably because you got lots and lots of messages when you were young and developing your image of yourself that you were bad, wrong, or defective just because you didn't fit social conventions often enough. There are people I've worked with ADHD who disagree about this, but I would say fundamentally you are not ADHD, you have ADHD. And I know And the distinction there again is this is one aspect of who you are. It may be an intrinsic, it may be a deep aspect of who you are, and it is not whole of who you are. The last piece is the association-based ADHD. And the clearest, easiest description, and I'll go into it, is lots of people in the ADD community are upset about me because I've written about Donald Trump's ADHD. Again, Donald Trump very clearly, robustly meets more than a dozen. You only need 5 of the criteria over time of inattentiveness, impulsivity. Emotional dysregulation is actually not part of the formal criteria, but he undeniably meets a criteria, undeniably has a severe case of the condition. And I think we should be talking about it to help educate people about ADHD. You can disagree about that. But again, to be ashamed of it because he has something that you have, I would argue, doesn't make a lot of sense. I mean, he's also male. He's also an American. He's also maybe 6'1" or 2 or 3, depending on what report you listen to. There are many attributes and aspects of him, and everyone who's 6'2" doesn't have to be ashamed of Trump because he's also 6'2". So why would you be ashamed because you share one thing in common with him? And the other thing to remember, again, and that's a side aspect of this, is that ADHD, although again it pervasively affects performance and interactions, how our brain is processing information all the time, it's affecting the process of information of what comes into our brain and what doesn't. It isn't determining the content. So the fact that Trump blurts things out, maybe something you share with him, but the fact that he's blurting out racist comments or sexist comments or strategies for injecting disinfectants into your body or shining lights up certain orifices or whatever to get rid of coronavirus doesn't mean you share the same content or would say the same things he does. ADHD affects how you process thoughts. You may have that in common with him, but that doesn't mean that the content of your thoughts is the same, because ADHD has nothing, or at least extremely little, to do with the content of your thoughts. What I'm talking here about shame can be applied to a whole host of other situations which shame comes up, not necessarily ADHD driven or connected. So if no questions are coming up, please be safe and be sane and take good care of yourself.